Welcome to the Perfect Perception Channel. Today we delve into a critical health topic, gonorrhea. As one of the most common sexually transmitted infections in the world, gonorrhea is a subject that's crucial to understand, no matter who you are. In this video, we'll be discussing everything you need to know about gonorrhea, from its symptoms and diagnosis to treatment and prevention. Knowledge is power, and it's time we shed light on this often overlooked issue. Stay tuned as we uncover the facts about gonorrhea. Gonorrhea, commonly known as the clap, is a sexually transmitted infection that can affect both men and women. This bacterial infection is caused by Neisseria gonorrhoeae, and it primarily infects the moist and warm areas of the body, including the urethra, eyes, throat, vagina, anus, and female reproductive tract. The bacteria are usually transmitted through sexual contact with an infected person, including oral, anal, and vaginal sex. However, it can also be passed from an infected mother to her baby during childbirth. It's worth noting that gonorrhea is one of the most common sexually transmitted infections, with hundreds of thousands of new cases reported each year globally. A crucial point to remember is that gonorrhea isn't a condition that only affects those who are sexually promiscuous or careless. Anyone who is sexually active can contract gonorrhea, making understanding it vital for everyone. Understanding gonorrhea helps in its prevention and treatment. Gonorrhea often shows no symptoms, but when it does, they can be quite severe. A peculiar thing about this sexually transmitted infection is that it can play a silent game, especially in women. Many women with gonorrhea don't even realize they have it because they experience no signs. However, when symptoms do appear, they can mimic those of a typical urinary tract infection or yeast infection. These can include a painful or burning sensation when urinating, increased vaginal discharge, or even bleeding between periods. For men, the signs are typically more noticeable. They may experience a burning sensation when urinating or a white, yellow, or green discharge from the penis. Sometimes painful or swollen testicles can also be a sign. Now, it's crucial to note that gonorrhea can also infect the rectum in both men and women, often through unprotected anal sex. Symptoms here can include discharge, anal itching, soreness, bleeding, or painful bowel movements. If gonorrhea is left untreated, it can lead to serious complications. In women, it can cause pelvic inflammatory disease, a serious condition that can lead to long-term pelvic pain, ectopic pregnancy, or even infertility. In men, untreated gonorrhea can cause a painful condition in the tubes attached to the testicles. In rare cases, this may lead to infertility. Gonorrhea can also increase your risk of getting or transmitting HIV, the virus that causes AIDS. In rare cases, if left untreated, it can spread to your blood or joints, which can be life-threatening. So, it's clear that knowing the symptoms can help in early detection and treatment. However, the tricky part is that these symptoms can often be confused with other conditions. That's why it's crucial to seek medical advice if you notice anything unusual. Remember, your health should always be your priority. Knowing the symptoms can lead to early detection and treatment. Diagnosing gonorrhea involves simple tests that can be done at a health clinic. So how exactly is gonorrhea diagnosed? Well, it's actually quite straightforward. Medical professionals typically use a urine sample to test for this common sexually transmitted infection. The sample is then sent to a lab where it's analyzed for the presence of Neisseria gonorrhoeae, the bacterium that causes gonorrhea. In some cases, doctors may also take a swab from the affected area. This could be the throat, rectum, or cervix. This swab is also sent to a lab for analysis. Remember, it's crucial to get tested if you think you may have been exposed to gonorrhea. It's much better to be safe than sorry. Timely diagnosis can prevent serious health complications, including infertility and an increased risk of getting other sexually transmitted infections. So, if you're experiencing symptoms or have had unprotected sex with a partner who has gonorrhea, don't hesitate to get tested. Timely diagnosis can prevent serious health complications. Gonorrhea is curable with the right treatment. Now that's a statement to build hopes around. But it's not as simple as popping a pill and forgetting about it. The treatment of gonorrhea requires a careful approach and full commitment to the prescribed medication regimen. The first line of defense against gonorrhea is antibiotics. These are powerful drugs designed to kill the bacteria causing the infection. A combination of two antibiotics, usually ceftriaxone and azithromycin, is often used. This dual therapy is effective because it tackles the bacteria from different angles, making it harder for the bacteria to develop resistance. It's essential to understand that the success of the treatment hinges on completing the prescribed course of medication. When you start taking antibiotics, you might start to feel better quite quickly. But feeling better doesn't mean the bacteria have been completely eliminated from your system. If you stop taking your medication too soon, some bacteria may survive and reinfect you. So it's crucial to take all of your medication exactly as prescribed, even if you're feeling better. In some cases, gonorrhea may be resistant to one or more antibiotics, making it harder to treat, but don't lose hope. Medical science is constantly evolving and new treatments are being developed. If one treatment doesn't work, your healthcare provider will recommend another. Now, it's worth noting that while antibiotics can cure gonorrhea, they won't undo any damage the infection may have already caused. So, early detection and treatment are key to preventing serious health problems. One last thing to remember. Getting treated for gonorrhea doesn't mean you're immune to it. You can get infected again if you have unprotected sex with someone who has the infection. So, taking steps to prevent gonorrhea is just as important as treating it. Treatment not only cures gonorrhea, but also prevents transmission to others. So let's take care of ourselves and each other by knowing our status, seeking treatment if needed, and spreading knowledge, not STIs. Prevention is better than cure, especially when it comes to STIs like gonorrhea. When it comes to preventing gonorrhea, the first thing that comes to mind is practicing safe sex. It's important to remember that gonorrhea is transmitted through sexual contact. So using barriers like condoms or dental dams during any sexual activity can significantly reduce the risk. But let's not forget, safe sex is not just about using protection, it's also about getting regularly tested. This is a crucial step in preventing the spread of gonorrhea. If you're sexually active, regular testing should be a part of your routine. This allows you to catch any infections early and take the necessary steps to treat them before they can cause serious health issues or be passed on to someone else. Now you might be thinking, I'm in a monogamous relationship, so I don't need to worry about STIs. But here's the thing. Monogamy only protects against STIs if both partners are infection-free. Therefore, getting tested before starting a new relationship and then periodically throughout is still necessary. Another crucial aspect of prevention is open and honest communication with your partners about sexual health. It might feel a bit awkward to bring up, but it's essential for protecting both of you. Discussing your STI status, the last time you were tested, and agreeing to use protection are all part of this conversation. And let's not overlook vaccinations. Currently, there's no vaccine for gonorrhea, but getting vaccinated for other STIs like HPV and hepatitis B can help maintain overall sexual health and prevent co-infections. Lastly, remember that while antibiotics can cure gonorrhea, getting reinfected is possible. So, prevention doesn't end after treatment. Continuing to practice these preventive measures is important, even after you've been treated. With the right precautions, you can protect yourself and others from gonorrhea. In summary, gonorrhea is a common yet preventable and treatable STI. It's a condition that, despite its prevalence, many people may not fully comprehend. We've taken strides today to change that, shedding light on what gonorrhea is, the symptoms it presents, and how it's diagnosed, so that you can be better equipped to protect your health. We've highlighted that gonorrhea is a sexually transmitted infection, prevalent, yet often misunderstood. We've delved into its symptoms, which can range from discomfort and discharge to, in rare cases, more severe complications. It's crucial to remember that these symptoms may not always be apparent, which is why regular testing is of utmost importance. We've also discussed how gonorrhea is diagnosed, typically through a simple urine sample. It's a straightforward process that can provide peace of mind or guide the next steps towards treatment. Speaking of treatment, we've emphasized that while gonorrhea is a serious condition, it is also eminently treatable. Several antibiotics can effectively cure the infection, preventing it from causing any lasting damage. And lastly, we've stressed the importance of prevention. Using protection during sexual activity and getting regular checkups can drastically reduce the risk of contracting gonorrhea. Remember, knowledge is power. Stay informed, stay safe. Thank you for watching, and see you in our next video.